people that have not enough good bacteria in their gut, like a dysbiosis, that tends to lead to SIBO in the future also. I tend to see patients that already have a lot of food sensitivities tend to get SIBO more often than others. So those are probably the most common things that I do see. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. In today's video, I'm going to share with you everything you need to know regarding SIBO. What is SIBO, or small intestinal bacterial overgrowth? What it is you have bacteria in your small intestine where it's not supposed to be. So we talk about probiotics and all that, right? We talk about this stuff. It's all supposed to be in our large intestine. It doesn't go to our small intestine. Our small intestine does all kinds of good things, but it's not where we store our bacteria. And it becomes a big problem when it starts being stored in our small intestine. So that's what small intestinal bacterial overgrowth is. You have these bugs in there in your small intestine when they're not supposed to be there. Now, it's a lot of different bugs. There's not specific bugs, but they do produce certain gases. And the gases that they make are mostly hydrogen or methane. And we have testing to be able to identify the hydrogen and methane. So we drink the sugar solution. Usually it's like a lactose sugar solution. You drink it, and then we measure how much hydrogen and methane is produced by breathing into these tubes like every 30 minutes for about 3 hours. So that's how we make the diagnosis of SIBO. And it doesn't have specific names for the bugs. Again, they're hydrogen and methane producing bugs is what small intestinal bacterial overgrowth is talking about. But there's also, and more rare, but maybe not as rare because we don't have a good way to identify it, is there's sulfur producing organisms, sulfate called sulfur-based SIBO, which I have made a diagnosis with, not with testing, but based on the symptoms that they're presenting with, because their symptoms are so pronounced and they have a lot of gas and bloating, and then they have really smelly gas like rotten egg smelling, like sulfur smelling gas, and they are negative for hydrogen and methane, but I'm like, you definitely look like you have sulfur-based SIBO. So those are the three different types of SIBO that we have: hydrogen, methane, and sulfur-based. We can make a diagnosis of hydrogen methane through a test. Sulfur-based is more based on the symptoms the patient is presenting with. Do symptoms differ based if they have different types of gas producing organisms like hydrogen, methane, or sulfur? And yes, they definitely do. But it's not perfect, but these are tendencies. So someone with methane producing SIBO, they tend to be really constipated. Someone that has hydrogen-based SIBO, they tend to have more diarrhea. But again, it doesn't fit perfectly. I don't see this fit that perfectly, but that's typical. And then sulfur-based, they tend to be constipated or diarrhea, and then they have really foul smelling gas, usually when they have sulfur-based SIBO. All of them come along with a lot of bloating, gas, either constipation or diarrhea. All of them have bloating or gas though. Abdominal pain is very common for majority of the gas-producing organisms, and that's usually related to the gas and bloating causing the intestines to start to spasm. Now, not everyone has pain. They might just have bloating and not pain. But yeah, it's not related to a specific type of gas-producing organism. Can other patients experience other symptoms than the digestive symptoms I just talked about? Yes. And the big thing is it's causing a lot of trauma and inflammation to the gut lining, which then that could lead to all kinds of symptoms that patients present with. They could be the cause of their headaches. It could cause chronic pain. It could cause chronic fatigue. It could cause tenderness in their joints. It could lead to autoimmune conditions. It even can lead to colon cancer or other type of cancer. So that's opening up a can of worms just because it damages the gut, which is so important for how the whole body works. And so you can experience so many other symptoms with SIBO besides just the gastrointestinal symptoms. How does someone acquire SIBO? So we don't know all the ins and outs of why someone might get SIBO, but we have some things that definitely lead to SIBO. And the biggest one of all is food poisoning. So I see this all the time. Patient comes into my office, they're like, I got some bug. When they're either outside the United States or in the United States, I was vomiting and had violent diarrhea. And now my gut has never been the same, and I'm just gas. I have a lot of gas and bloating, and I have diarrhea all the time. It's just not clearing up. So food poisoning is very common. It's not various types of food poisoning, right? A lot of different bugs, E. coli, salmonella, etc., could all be related to that, but that can lead to SIBO. What I notice also is SIBO is people that have not enough good bacteria in their gut, like a dysbiosis. That tends to lead to SIBO in the future also. I tend to see patients that already have a lot of food sensitivities tend to get SIBO more often than others. So those are probably the most common things that I do see. Oh, also post-surgery, that can be a big cause of SIBO. I see a lot of my colon cancer patients get SIBO after getting the tumors removed. Also, I see it after patients that have ulcerative colitis get portions of their colon removed, and that leads to SIBO. So those are some of the main causes of how you can acquire SIBO here in the United States. Yeah, one thing that I forgot to talk about definitely is hypochlorhydria. That's the fancy way of saying too little HCl production. That is a major cause of SIBO, 100%. So taking omeprazole or other acid suppressant medications can lead to SIBO in the future. Also, as you age, your hydrochloric acid decreases. That increases your propensity of getting SIBO also. So yeah, like you're saying, the acid breaks down the bugs so you don't get them into your small intestine, but if you don't have enough acid in there. So yeah, people taking omeprazole definitely have increased risks of getting SIBO, and also just being older, you have increased risk because of the decreased HCl production that is made. What is the treatment for SIBO? I'm going to talk about what is the regular treatment that the regular conventional medical doctor does, and then I'll talk about what my approach is. So first is the regular conventional approach. I thought they would prescribe a lot of rifaximin, but I'm just giving you a report of what I'm seeing more often, what my patients are reporting to me, what gastroenterologists are prescribing now. Since rifaximin isn't covered by insurance very much, at least that's why I think they're doing this, is there are many times prescribing several different forms of antibiotics to go after killing SIBO, which I think is problematic all of it itself, because rifaximin is different than the other antibiotics. But they're prescribing like Metranidazol and Niamiacin. These are the most common antibiotics that they're prescribing. Now, these are antibiotics that are many times prescribed with rifaximin, or they're prescribed if you have something called methane producing SIBO. So you prescribe neomycin and metronidazole for that. But what I'm seeing a lot of times is doctors are just prescribing neomycin or metronidazole. But the standard of care and the best treatment that should be done by most conventional doctors is they should be prescribing rifaximin or Xifaxin. But again, I don't see that being prescribed as much as it should be, because that is a highly effective treatment in going after the SIBO bugs. Tons of research on it, but it is an expensive medication, and for some reason, the insurance doesn't really like to cover this. Like 40% of insurance companies are covering this medication right now. Does rifaximin treat all types of SIBO? And the answer is yes. And metronidazole and neomycin do have some effect on killing off these bugs too, but they're nothing as good as rifaximin. And to really go after methane producing SIBO, we don't just do neomycin and metronidazole. We really need to do a combination of rifaximin and neomycin or metronidazole. What we've seen is methane producing SIBO tends to be the hardest SIBO to kill. So that's why we have these other bugs to go after. And sulfur producing SIBO is a very difficult one to kill too. The easiest one is hydrogen-based, and that's just a relative term because it's not that easy, but it's just easier than the others to really eliminate. What is the cost of rifaximin? So there's a lot of costs. There's financial costs and there's a burden on the body, right? So rifaximin is extremely expensive. It's about $1,500 to $2,000 for just a 2-week supply if it's not covered by your insurance. So very pricey. Metronidazole and Xifaxin much cheaper, maybe in the 100, maybe 200 for about a month supply. So much cheaper there compared to the rifaximin. But now let's talk about, how do I approach SIBO? So doing the standard of care usually takes care of 30% of patients with SIBO. They just do the rifaximin and they're cured. If you're the lucky one, hallelujah, right? But majority of people, 70%, they need other treatment. They need other advice and need to do more detailed treatments like that I provide. So what I do is I do prescribe the rifaximin. If someone has methane producing SIBO, I do prescribe the neomycin and metronidazole because there's such good research on that. But usually you need to do other treatments too. I prescribe some herbs. And sometimes you don't absolutely have to do rifaximin. You're like, I don't want to take this. It's also too expensive. I'm not able to get it. So then we prescribe just the herbs, which do tend to have a lot of research on them to be very beneficial also. So you don't have to do the combo. But if I can, I usually do a combination of rifaximin with the herbs. So the herbs are berberine. That's my favorite one. It's good for all the bugs, different types of SIBO out there, hydrogen, methane, and sulfur. It works great. Also, we have oregano oil. It's broad spectrum too. It's good for all the types of SIBO also. Now, SIBO methane producing, I add some other things on there. For example, I like to add neem many times to my treatment protocol if I'm going after and methane producing type of SIBO. And then I always like to prescribe a biofilm breaker. So just like with all kinds of chronic infections, SIBO has a biofilm. It's a mucus outside layer that's very difficult. That makes it very difficult for the substances to kill the bug, also difficult for your immune system to kill the bug. So we want to strip off that mucus outside layer so then our substances are able to kill it off. So a biofilm breaker would have like EDTA or alpha lipoic acid. Those are somewhat natural type of substances. EDTA is somewhat natural, not really, but it's a great biofilm breaker. But something that I really like that I send into a compounded pharmacy and is like the strongest biofilm out there is a combination of DMSA, bismuth subnitrate, and alpha lipoic acid. Those are combined together and make a completely different substance, which is an extremely strong biofilm breaker that works really well for my SIBO patients. So we prescribe the biofilm breaker, we prescribe the Rifaxamin, we prescribe the berberine oregano oil, and voila, we are able to kick the SIBO. So like my conventional colleagues, I like to use Rifaxamin to treat SIBO, and I could get it for a really good price. I know if it's covered by insurance, great. Some of my patients get it prescribed, but a lot of my patients are able to. So I've been able to figure out how I could get it for a much cheaper price for my patients. But many times we can't eliminate every tiny little bug that's hanging out in the small intestine. So many times we have to do touch-up treatments, I call them. Okay, we get you feeling good for 6 months to a year. Now we have to do another round of some treatment. And that's the unfortunate thing. Now, some things that you could do to keep it from coming back is you follow like a FODMAP diet or a SIBO specific diet to not feed these bacteria so that it takes much longer for them to come back. And sometimes we treat the SIBO, we're able to get you feeling good, but not all the way there. Then we have to prescribe a SIBO specific diet to really get all the symptoms cured. Most patients with SIBO also have food sensitivities. I always do a food sensitivity test, like a leukocyte histamine response test, to identify those and eliminate those foods too, because they could not get a ton of improvement with the treatments we're doing because they're still reacting to certain food reactions. So we want to eliminate the food reactions and also kill the SIBO at the same time. But what the SIBO specific diet does is FODMAP diet was not formulated for SIBO. It was made to help people with IBS, which is interesting. 70% of people with IBS have SIBO. So if you've been diagnosed with IBS, you definitely need to get SIBO checked out. But this was made, some researchers put these foods together and noticed that people did well with following this diet, removing certain foods. So that's the FODMAP diet. It's for IBS. SIBO specific diet has gone even further, and it's eliminating the vast majority of the foods that are going to feed that bacteria. So in a nutshell, it's eliminating a lot of different sugars and fibers that are in food. And this is some overlap there, like onions and cruciferous vegetables like broccoli and cauliflower and bok choy and garlic and many other foods that feed these bacteria. Like SIBO-specific diet is different than FODMAP diet is it doesn't allow you to have any type of dairy at all. On FODMAP, it allows you to have cheddar cheese, which in my experience, most patients don't do with cheddar cheese when they have SIBO at all. So the FODMAP diet doesn't work well in that regard. So are probiotics good for SIBO? I would say vast majority of the time, no. The symptoms will get worse most of the time. Now, I like to do a spore biotic. That tends to not be as bad for SIBO patients. They tend to be able to take that while we're killing off all the bugs, but that's not always the case. But in my experience, they do pretty well with that, and I like prescribing that with the SIBO. But in majority of the time, no, you don't want to do probiotics with SIBO. Once we kill off the bacteria and put it more in a dormant state or have very little left, patients should be taking a probiotic because that will help put in the good bacteria into the large intestine. And if you don't have a good amount of good bacteria in the large intestine, you tend to have a higher propensity to get small intestinal bacterial overgrowth. So it's good after you actually eliminate the SIBO. So to say not good with active treatment, but it's good after we eliminate the SIBO. So why is a spore better than a adult bug, right? It's because, it bypasses the stomach, the small intestine, goes into the large intestine and implants itself. and then it's able to be made in the mommy and daddy bacteria in the more mature state, and that's why it's better for patients with SIBO. If you want to learn more about gut health, click my videos to the right. I'm Dr. Jake, and I'll see you there.